This is Dr. Ruley from Advanced Spine Health Center in Urbandale, Iowa. And today I want to talk about sciatica. Now this is going to be the first of a series of videos that we're going to do talking about different problems we see here in our office. And really the goal of these videos is to talk about the causes of each one of these problems. And that's what we want to do today with sciatica. So what is sciatica and how it gets its name? What are the two most common causes of sciatica and what the causes of those causes are? And then what we do differently here in our office, both to treat and to prevent sciatica. So what is sciatica? So sciatica is the impingement or irritation or inflammation of the sciatic nerve. Now the sciatic nerve is the largest nerve in our body, and it runs from our low back out the back side of our buttocks here in our pelvis, across our buttocks and down the back side of our leg. So the sciatic nerve is really a group of 5 nerves all starting in the low back, and they start here with the lumbar spinal nerves, the last 2 lumbar spinal nerves in our back, the 4th and the 5th lumbar spinal nerve, and then the first 3 sacral spinal nerves that come from this triangle shaped bone here called our sacrum. The first 3 of those connect with these 2 in our lumbar spine, and those 5 come together to form the sciatic nerve. Now that sciatic nerve comes together and runs outside of this notch here in the back side of our pelvis and runs across our buttocks and down our leg. And that's usually where we get the pain when it's irritated or when it's inflamed, is across the buttocks and down the leg and sometimes in the low back. So what are the 2 most common causes of sciatica? Now the number 1 most common cause of sciatica is a disc bulge or a disc herniation, and most people know what that is. And you can see from this model that this red disc herniation actually comes out and irritates or pinches on this spinal nerve. So when it does that, it goes down the course of the sciatic nerve and causes sciatica. So the second most common cause is called Piriformis Syndrome, and Piriformis Syndrome is really the spasming of the piriformis muscle. So the piriformis muscle runs from the front side of our sacrum here, again, this triangle shaped bone, front side of our sacrum across our buttocks to our femur, which is our leg bone. So when that muscle spasms, it irritates that sciatic nerve as it comes out of this notch. That sciatic nerve can run underneath the piriformis muscle, over top of the piriformis muscle, or sometimes even through it. It doesn't really matter when that muscle spasms, it can irritate that sciatic nerve and cause sciatica. So those are the 2 most common causes, disc bulges being the most common cause, and then Piriformis Syndrome being not as common but another cause. So now what really causes disc bulges and what really causes Piriformis Syndrome or spasming of the piriformis muscle? So starting with disc bulges, what really causes disc bulges? When you go and do a quick online search, what you really find is people talking about water loss in age of our disc. So as you get older, you lose the water in our discs and it shrinks and you get disc bulges or disc herniations, and that's partly true. We do lose water in our disc as we age, but that's not really the cause of what causes those disc bulges, or everybody would be getting disc bulges and sciatica. So what really causes that is a structural problem in our spine, and there's 4 things we need to look at in the structure of our spine that indicate higher risks or causes of disc bulges and disc herniations. Now those 4 things are the tipping of our pelvis, or the tipping down of our sacrum. The sacrum is part of the pelvis, so the tipping down or the lack of tipping down, the curvature in our low back here, and then the balance of our upper back if we're forward or if our head is forward. And then the 4th one is a curvature in our low back, or a scoliosis or a pseudo scoliosis. So those 4 things are really what can cause a disc bulge, and they do that, and I'll show you how they do that with x-rays. So that's usually the easiest way, and that's what we use to find these problems in people is through x-rays. So with this person, you can see this is a x-ray of the low back from the side, and so the first thing we want to look at is the sacral base angle, or the tipping of your pelvis. So right here is the side view of that triangle shaped bone, and we look at the top. We would draw a line across the top, and that gives us our sacral base angle. Now this person has a very, very flat sacrum. It almost runs horizontal with the picture. Normal sacral base angles run about 40 degrees, which comes down here toward the corner of the picture. So when you have a flattening of your sacrum, you a lot of times will have a flattening of your low back, it influences the curvature of your low back, which is a lot of the cause of disc bulges. So that brings us to our second point. You can see with our program here, we have nice green and red lines that give us kind of a visualization of where our spine needs to be, which would be the green line, and then where our spine is, which is the red line here. So this person's spine is back from where it's supposed to be, and it also loses that nice curvature that it's supposed to have, which is about 40 degrees of curvature. When you lose that curvature, that's another cause of disc bulges. So this person also had, this person also had forward posture of their upper chest and of their head, so they stand like this. And when we do that, it puts our center of gravity forward. And when we have forward center of gravity, it puts more pressure on the front end of those discs, the front end of those vertebral bodies. And when we do that, it forces that disc backwards like an ice cream sandwich on a hot day. If you pinch one end, the ice cream shoots out the back end. Same thing with our disc, especially over time if we're playing sports or riding in a truck or whatever that may be. Over time, that pressure wears that disc out, and then you get a disc bulge out the back end. Same thing with the curvature on our spine. When we lose that curvature on our spine, it puts pressure on that front end of that disc and pushes that disc backwards. And the sacrum, the tipping of our sacrum, it deeply influences that curvature of our spine. The fourth way that I was telling you about is the curvature from the front view, which is another x-ray we have here. So here's another x-ray from the front view. And when you look at that, you can see this person has a short leg here on the right side. The sacrum is angled downward here, which is this red line. Now, when you have that, it puts a curve in your spine off to that side. And they call that sometimes a scoliosis, but really it's really called a pseudo scoliosis because it's not a twisting of your spine. Now, this is an easy fix for us here in this office. We just give them a $5 lift on this right shoe that pushes that back up to level, and this curve that's in our spine comes out. And you can see how that curvature in your spine would put uneven pressure on a disc and cause it to bulge out. So, and that brings us to the second cause of sciatica, which is Piriformis Syndrome. So Piriformis Syndrome is the spasming of that piriformis muscle. What we need to look at then to what causes the spasming of a muscle is what controls a nerve. So controls a muscle, Muscle tissue on its own outside of the body or without nerve control is just contractile tissue that sits there and does not do anything. It needs nerve influence to actually contract. So when a muscle contracts, whether that be a spasm, a twitch, or anything like that, it's because of the nerve, not because of the muscle. So you can rub the muscle all you want, you can stretch the muscle all you want, but you're not going to fix that firing of that nerve by doing that. So when we look at a long-term firing of or spasming of a muscle like the piriformis or Piriformis Syndrome, we need to look at the nerve and what's causing that. And to explain that, we need to explain what a stretch reflex is. A stretch reflex is when we have long-term stretching of a muscle or even short-term stretching of a muscle. When we stretch a muscle, it sends information back to your brain saying, hey brain, I'm being stretched. If I keep stretching, I'm going to hurt myself or I'm going to have an injury. And the brain goes, yep, that's right. And then the brain, through our nerves, sends information out to make that muscle contract so that doesn't happen. That's what a stretch reflex is. So when we look at taking that away and getting that muscle to relax, we need to look at what's really stretching that muscle and causing that to happen. So to explain that, we'll look again at this front view of our spine here, and I'll explain it that way. So when we look at the front view of our spine here, you can see when we have a sacrum that's tipped down on one side, it makes this triangle-shaped bone, this sacrum, which I'm outlining here, makes it swing off to the left side or to the opposite side of the short leg. And when you do that, it stretches the piriformis muscle on this side, which would be this person's right side. So that's the stuff we need to look at. We need to look at the tipping of the sacrum. We need to look at the functioning of the leg, which is the other connection of our piriformis muscle. And those are really what can cause that muscle to stretch and cause that stretch reflex. And that's what we do differently here in our office to correct these problems, is to actually look at the structure that causes the underlying problem and to fix that. And the only way you can fix that is by stretching ligaments or ligament creep over time, they call it, which is basically shaping your ligaments to hold in the correct position. So that's what we do in our office. It's called BioPhysics Care. So if your sacrum is too flat, we pull your pelvis forward to put more curve into your back. If your low back does not have enough curve in it, we use traction machines to pull the curve into that low back. If your chest is too far forward or your head is forward, we use traction machines to pull those over your pelvis and pull your head over your shoulders to pull that off. And same thing with curvature to the sideways, to the side of the spine from the front view is putting lifts in our shoes to take that curvature out, to take that tipping of that sacrum out, or to actually pull on a scoliosis if it's a true scoliosis to help straighten that out a little bit. So that's what we do here in our office. It's called BioPhysics Care. So if you're interested in more of this stuff, keep in touch with us, stay in touch with our videos, watch our upcoming videos, give us recommendations for our upcoming videos. Again, my name is Dr. Ruley from Advanced Spine Health Center in Urbandale, Iowa. Check out our website, it's advancedspinehealthcenter.com, and keep in touch, guys. Thank you.